Good morning, and welcome to the Hawaii Health Data Warehouse Coffee Break Monthly webinar series. My name is Tanya Lowry St. John, and I'm the Public Health Epidemiologist with the Hawaii Health Data Warehouse, or HHDW, and also an Associate Specialist here at the Office of Public Health Studies at the University of Hawaii at Manoa. We're going to use the next 30 minutes to tour our newly redesigned Hawaii Health Data Warehouse website to help you find the data that you need. Let's get started with an overview of the newly redesigned Hawaii Health Data Warehouse website. The Hawaii Health Data Warehouse website, hhdw.org, has been redesigned to make it easier to find the data that you need. HHDW worked with our partners, focus groups, web designers, programmers, and our IT staff to create this site over the past year. Thank you to everyone who's walked with us on this journey. As part of the redesign, we have fully integrated the Hawaii Indicator-Based Information System, or Hawaii IBIS, into the website and increased the interconnectivity with our sister website, Hawaii Health Matters. We've also tried to make things easier to find in fewer clicks. But in doing so, we move things around a bit. So let's walk through it together. We'll start here at our homepage. Here you can see links to our two most popular tools, the Hawaii Health Matters, or HHM, and Build Your Own Report. We'll get to those in a minute. Scrolling down, you can see a brief overview of the site and of our news and announcements tiles. Here you'll find information about the latest data releases, our coffee break series, the featured content on Hawaii Health Matters, or HHM, and our Instagram feed. If you click on a tile, you'll see a brief news story, and then links to the past 3 news stories. You can also click on report highlights to see all of our news stories, and the same here with news and announcements. If you are not an Instagram user, never fear, we're also on Facebook and YouTube. You can find links to our pages and the icons here in the footers. Please follow us on Facebook or Instagram to stay up to date on the data releases and featured content, and you can also subscribe to our YouTube channel to see our latest website tools and data release videos. Scrolling back up, you'll see this series of icons, which is available throughout the site. These make it easier for you to either email the page or share it on social media. You can also use the print icon to either print the page, or you can save it as a PDF if you want to save the content. Our new design makes it easier to get to the Hawaii Health Matters homepage from this big block here on most, for most pages on the site. You'll see a smaller block with the Hawaii Health Matters header, as well as the Build Your Own Report header. So here we go. This is our About page, which tells you about, so you see the smaller headers to get to those different sites, or different place within this site, and then our sister site. This is our About page, which gives you some more information about HHDW, and it tells you about our long-standing partnership with the Hawaii Department of Health, as well as the 2 websites we use to make data available to the public. The hhdw.org website, as I mentioned, is built on that interactive query system. And this system allows users to view pre-NAID health indicator reports or build their own custom reports by querying public health data sets directly. The public data sets in Hawaii IBIS are managed and provided by the Hawaii State Department of Health through the Hawaii Data Warehouse. The data sources that are housed within HHDW are birth and death data, behavior risk factor surveillance system, the pregnancy risk assessment and monitoring system, or PRAMS, the youth risk behavior survey, or YRBS, and the youth tobacco survey, or YTS. And we'll get to these later in the presentation. There are 3 ways to access data within the system in order of configurability. You can either view a community report, you can explore a health topic, or you can also build your own report. Community reports allow users to look across data sources and health topics to see how a community is doing compared to the state overall. We currently have 3 communities: county, race, ethnicity, and sexual or gender minority status. And then we have 2 lists of health indicators: chronic disease indicators and health risk indicators. Throughout the site, whenever you see a question mark, you can hover on it to get some more information. Or if you see a little eye in a circle, you can also hover over that to get information about the indicator contained underneath. Let's go ahead and run our first report. We'll stick with race ethnicity, and let's just go ahead and switch to Filipino. and the report automatically runs itself once you select those things. So here you'll see we have a report for Filipino race ethnicity, and it's our community report. And you can see this chart underneath, which will give you the list of the chronic disease indicators that are included in this report. And then also, because this is our chronic disease indicator list, amongst what the point prevalence is amongst the Filipino population, what that confidence interval is, and how the state is doing as a whole. Scrolling down, you can see the list of indicators that are included in this report. And you can see these little icons here, which help you easily compare how the Filipino population is doing compared to the state as a whole. So here you can see they're doing worse. Here you can see they're doing better. And here you can see they're doing about the same. We have a little key at the bottom that helps explain that to you and let you know that those differences are based on statistical significance in terms of whether or not they're doing worse, better, or the same. If you want to learn more about one of these reports, we'll go ahead and click on the report itself. So this is going to be youth obesity. So this is going to be our YRBS data, which was of interest to our population today. And you click here, and you can see that you get the standard summary indicator report of some different as one of our data view options. So scrolling here, you'll see the percent of youth who are obese in high school. You get by race ethnicity, by county, and when it is available by sexual or gender minority status, if the population size is big enough. That's one of those data that we only collected in the last 2 iterations, so it will be up as we load the 2021 data when that becomes available. Here you can see that you can mouse over any of the information on the charts to reveal the data underneath. Also scrolling down, you get the information of the why is it important section, which lets you know about the importance of this data and the definition, how it's defined, any of our data source information, and as well as how the measure is calculated. So we can come back up here and we can configure this report. Let's say we want to dig a little bit deeper into, we can look at it by race, ethnicity, county, the complete report, which is all of the data. So let's go ahead and look here at the race, ethnicity. And you'll see for this health indicator report, you have again that chart that you saw before, but now you're going to see the underlying data table. Throughout the website, whenever you see these 3 little dots, it means that you can do some work here. So let's go ahead and click on there, and we'll say we can go ahead and sort this, and let's go ahead and sort it in descending order. So from greatest to least, and we'll go and we'll take a look here at how any changes that we make here in the table are now reflected in the chart above. So then we can see if we're interested back in the Filipino population, that where they fit in terms of the percent that are obese compared to the US overall, Hawaii overall, and then the other race ethnicity groups. So while they are, slightly higher than Hawaii overall, they're not as high as other Pacific Islanders in terms of in Hawaii. So you can take a look here and do some work. And again, if you're interested in this information and you want to save it, you can also here, if you want to see if we have more information, you can click here on associated health topics. So we have obesity and related factors, and that we'll cover in our next section. But you can also go ahead and print, you can email, print, or share this information on social media. So that will bring us to our next area, is if you know your area of interest, but you aren't sure what data is available, then health topics is for you. So we'll come over here to our health topics. So here in health topics, you can see our data arranged into 19 different health topics. Each topic includes, so we'll go ahead and look at tobacco today. Each topic includes a brief description. So you have a description, why it's important, what is known, who is at risk, how to reduce that risk, how it's tracked, indicator reports, queryable data sets, publications, and resources. This is a good time to point out this tool. Whenever you see a white triangle within this color block, if you click on the triangle, you will reveal the information below, and you can click it again to close it. So it's just a thing that you'll see throughout the site, and you want to know what's underneath there, go ahead and click it. Once you've reviewed the health topic information, you may want to spend some time here in the indicator reports. The Hawaii IBIS indicator reports are static reports that are used in the community report module. They function like the ones we just saw. So if we took a look at this and we take a look at tobacco, current e-cigarette smoking in high school, you'll see that same sort of report that we just saw, and you would be able to work with it in that same fashion. Also in here, you'll see our Hawaii Health Matters indicator dashboards. You can see here with this little box with an arrow pointing out lets you know that when you click on this, you're going to go to another site. You'll see two kinds of dashboards in this area. You might see something like a full-blown tracker. So here's our tobacco use prevention and control tracker, which we covered in last month's webinar, which covers the priorities of the tobacco prevention and control program until 2030. If you want to learn more about this, you can actually, there's a video here, and there's also videos embedded within the Hawaii Health Matters website. Or you can click on one of these, which would be a custom tracker, a custom dashboard that we have created, our staff created, to let you see some of the data that's available within Hawaii Health Matters. One of the things about Hawaii Health Matters is it is not limited to those data sources that we covered before. We also pull in national data into this site. The next way that you can sort of see what kind of data that we have available on this topic area is here in the queryable data sets. So you'll see here the list of data sources and then the reports, the indicators that are available underneath this. So you can go ahead and you can see that they're divided by data source. So these are the tobacco related indicators we have in the behavioral risk factor surveillance system and the PRAMs and youth risk behavior. And we just sent you directly to the module for the youth tobacco survey because that's what it's all about. But if we go ahead and click on one of these, this will bring you to a queryable data set. So now you can actually do real work on the data. So the first thing you're going to see is our data use agreement, where you're going to agree to keep the data confidential and let us know if you see anything kind of stuff. So you would click agree, and then now you would see our standard report, and then you can go in and modify that. And we will get to that in just a second as to how to do this. So going back to our health topic, again, you can share this page either by emailing it or on social media. You can also expand all this information and then print it or save it as a PDF. But I recommend that you do expand all of these so that you can get the information underneath there. The next way is that if you know about the data source that you're interested in and you want to build your own report, there's a few ways to get to the query builder. We showed you how to get to one through health topics just now, but if you want to know a bit more about the data source first, you can come up and select from this drop-down menu. One of the things people were interested in was BRFSS, so we'll go ahead and click on that. And this will bring you to the BRFSS data source page. So here you have a little bit of information about the data source, and then here you have data release notes information about the data source in HHDW. So for each year in which we have data, we provide you the information about the number of individuals who were surveyed that year, a link to the actual survey that was used that year. So if you really want to know how did they ask that question, where was that asked, what was the skip pattern, our year-specific data release notes, and then also the extensive CDC documentation that comes with that. So this information is right here in the chart, and it's all in one easy place for you to find when you need to know more about that data source. And coming down a little further, you'll see this new feature that we have where you can actually, if you've been working with the data and you still have a question or you can't find a certain indicator, you can actually submit a report request to us saying, hey, I can't find this, can you help me with this? Can I get a special report? You'd use this function, which will bring you to a form to fill out. Or if you say, I really like this data, I want to do my own very elaborate analysis, so I need record level data, you could come here to the record level data request. If you click on that, it will bring you to the record level data request for the specific data source you're in. So today we're in BRFSS, and you can see here you'll have a step-by-step of how to go about requesting record level data, including the fillable proposal forms and so forth. We also have additional documentation here in terms of learning about that data set that you're going to need if you're doing analysis, and also our updated documentation on how we have derived the dimensions for race, ethnicity, poverty level, geography, and sexual or gender minority status within the warehouse. So all of these new resources are available for you in one place. If you know you're going to be requesting a lot of record level data from different sources, down here at the bottom, you can go ahead and click on one of these links to the other data source you're interested in and find out about how to do a record level data request for there. So scrolling back up, this is a good time to sort of point out the breadcrumbs feature that we have on the website. So as you're going through at this point, I could go ahead and click the back button, or I can just go ahead and click here to go back to the previous page. So it's just a little functionality that's there for you. And then now if I want to build a report in BRFSS, I can go ahead and click on this build a custom report here. And this will bring me to the health indicator selection page. Alternatively, if I already know about my data and I don't need to go and look at extra information about the years, if I'm on the home page, I can go ahead and click on Build My Own Report. And this brings me to our selected data source page. So here you can see graphically the data sources that we have. And we can go ahead and click back here on the behavior risk factor survey. And then now we are back here at that selection page. So again, with the selection page, you've got information about the data source itself. You've got our data release notes, and we have related videos. So our last coffee break webinar that we did on this to let you know what happened when we released the 2019 data. We'll do another one when we release the 2020 data. And we're going to come down here and we're going to go ahead and click this open to be able to see some more information. Let's go ahead and take a look at insurance and healthcare access. So if I'm not really sure what this means, I can go ahead and hover over here so I get the definition of what we mean by having coverage. I'll click down on this arrow here and I see there's two levels of reports available. There's a accrued report and an age-adjusted report. If I'm not sure about the difference of those, I can go ahead and hover over to find that information. For now, I'm going to go ahead and include age-adjusted. And this will bring us to the standard report for the Build Your Own Report page. So you'll see here that we have the buttons that we're going to use at the top to go back and modify. You have the information here about your query criteria. So what it is exactly you selected, the years, any filters that you've applied, and how the data is grouped. Then you have the chart that'll be underneath. And then again, you have the data table, always with the prevalence, the confidence interval. Then we have the count and the annual estimate. And then again, we have that new feature that you can go through and say, maybe I'm not interested in this data, I want to go to other data sets. If I click here, it takes me back to the data set selection page. Or if I maybe want to do a different health topic, I can click here and go back and search through the topic pages. So there's just a different way to access different parts of the data. And coming down, you'll see all the technical notes that are going to be related to this data query. So in terms of the measures and the sources and any issues that you need to know when looking at this data. And then coming back to the top, the real power, of course, in the system is that you can come in and modify this query. So you go ahead and click on the Modify Query button, and this brings us to the query selection, the query builder for this. And the first, in all of them, the first steps are always going to be ways to filter the query. There's different numbers of steps per data source, and the last step is going to be how to display the data. So for example, if I wanted to look at the data across more years, I can go ahead and hold down my Shift key, and let's go ahead and pull up the last 5 years of data. If I wanted to limit my query to a certain county, island, community, or primary care service area, I can, or a group of those. And then I can also do by sex, other demographic characteristics, and then other population behaviors. But for this query, let's just go ahead and look at it by year. And then these are all the different ways that you can display the data. So you can display all of them by 2 different dimensions, and we'll go ahead and look at it by sex. And actually, just for funsies, you can also change a little bit of the charting. So let's say if we want to go and with a vertical bar instead of a horizontal bar, we're vertical bar people. And then we will hit that submit, and then we submit our data, and then we can sort of see this with data labels across. And again, we have the data here below. We can sort and so forth if we want, but you can go back and modify then this query to your heart's content. Again, if you want to download this data, you click on the Export to Excel button. If you would like to take a screenshot or print, you can do that for their chart. You can also go ahead and print or email or share it on social media. So these are just our options that we have for the data for building their own report. If you want to know more about building your own report, we have a lot of information in our YouTube channel and then throughout the website. So as I mentioned before, I'm not going to leave you hanging. We covered a lot really quickly today, and we have a lot of this information here in our tools and resources. The first things I just want to point out to you is our newsletter and to request training. So you have the ability to sign up for our newsletter to always be on top of what we're doing. And then if you want a training for your group or your organization about a certain topic within the warehouse or a certain data set, we can provide those. We also do classes, so please let us know. You can hit the select training and fill out that form. In our how to use section, we have information again about both the 3 topic areas we covered, but also on how to cite the data that you see here, and then information about reading our charts and graphs. And back up here in the training and resources section, you'll see again the 3 different ways to access the data, a list of pro tips, and that will be growing. You'll have files that can link you to all of our different coffee break series, such as here on our YouTube channel. So you can see every time we release a new data source, we do a quick webinar on it. So it's a great way to get more in-depth information, and then information about our next training. And then those tutorials about the stuff we covered today. We have a special one on using community reports on health topics and how to build your own report. And always, if you still need more help, you can contact us here at profiles@hhdw.org or give us a call. We are here to help, and we want to help you access the data that you need to answer your questions. Okay, thanks very much, everybody. Have a great day.